Hi everyone, welcome to researchmd.com. My name is Dr. PRAMIL. So we're going to go back to our cardiology examination or board review questions. Very high yield concept. That's what we're going to talk about today, okay? So let's look at the scenario or I don't know how many of you heard the story last week. The NFL player, while he was playing football, had a sudden cardiac death. So his teammate and the paramedics came to the field, did CPR, and took him to the hospital. So the question is, what is the appropriate things after you get discharged from the hospital? Okay, so the clinical question probably we got we can say a 24-year-old playing football. Went into sudden cardiac death. Or we can say cardiac death or arrest. Okay, so what is the next step in this patient when after stabilization, after discharge from hospital, what should we do? What is the next step? Okay. That is the question is going to be. So again, this question is going to be got a young person playing soccer, playing football or anything, and sudden cardiac arrest, went to the hospital, they stabilized him, and he came back to normal, and they get him ready to discharge from the hospital. What would you do in that situation? Okay. Now, what is the most common answer people usually pick? They can say like a reassurance. This is the most common. They say patient is fine, and send him home with a reassurance nothing is going to happen. Some people, I can say genetic testing because maybe something else going on. These are the two common wrong answer we usually pick. Okay, so what is the correct answer in this patient? The correct answer is you have to place this patient, you have to put an ICD in this patient, okay? So the correct answer is ICD. You have to place the ICD, it need to be placed, a defibrillator should be placed in this patient before we can discharge it from the hospital. Okay, now let's look at the secondary indications for ICD placement. What are the indications? Secondary indication for ICD. ICD placement. Okay. One thing we already said, right? There's a sudden cardiac death or arrest, then definitely they need to be on ICD. Let's say sudden cardiac death. Okay. Now, what is the second? The second is you got sustained ventricular arrhythmia. Sustained ventricular arrhythmia greater than 30 seconds. Okay. Now, let's say the patient is on a Holter monitor or like a long-term monitor. They found sustained ventricular arrhythmia greater than 30 seconds. You need to place the ICD. Or let's say the patient in the hospital, on the monitor they found the greater than 30 seconds ventricular tachycardia. You also need ICD. Okay, the question is all about secondary prevention in this patient who had like a sudden cardiac death. What would you do? The answer is ICD or defibrillator placement, okay? Thank you so much for watching. God bless.